causative association between Tylenol given in pregnancy and the perinatal periods is not sufficient to say it definitely caused autism, but it is very suggestive. And it's suggestive in animal studies and core blood studies, in observational studies from nation to nation. And so there should be a cautious approach to it. And that's why our message to patients, to mothers, to people who are pregnant, to the mothers of young children is consult your physician. And we have asked physicians to minimize the use to when it's absolutely necessary.
He's claiming that the causative association between Tylenol and pregnancy and autism is very suggestive. Notice the choice of words. He admitted literally 1 day later that he doesn't have sufficient evidence for this claim. His exact words were, "We're doing the studies to make the proof." This is the nation's top health official who is spewing nonsense on what he openly admits is essentially a hunch. And he's doing this all while we already know who's doing the studies. You know, the thing you're supposed to do before scaring millions of pregnant women who already have enough on their plate and are already hard enough on themselves as it is. Like, maybe we should consider, instead of stoking fear, we can maybe ask pregnant people, how can we make your life easier? Can we ensure paid family leave, accessible healthcare, and real support instead of anxiety through like random Tylenol studies? Studies are important, yes, but so is giving expectant parents the resources that they need to actually thrive and not just survive. So while the headlines chase hunches and real policy does not exist, which could help them rest easier or see doctors when they need to and focus on bringing a new life into the world, instead they're getting unnecessary panic from RFK Jr. But it gets better. Texas Attorney General Ken Paxton has already filed a lawsuit against Tylenol's parent company based on these completely unproven claims. And Trump, a man also with zero medical training, has been posting in all caps on Truth Social, "Don't use Tylenol unless absolutely necessary. Don't give Tylenol to your young child for virtually any reason." Meanwhile, the actual science says something completely different. The largest study published in JAMA in 2024 examined 2.5 million births in Sweden. When researchers did sibling analysis comparing siblings born to the same mother, the same association between acetaminophen, Tylenol, and autism completely disappeared. This tells us genetics and environment explain the correlation, not Tylenol.